Why your muscles never fully let go. You wake up in the morning and your traps are already knotted up. You climb into bed at night. Same thing. Then there's that mysterious little twitch fluttering underneath your left eye, and the jaw tension you carry around like it's part of your personality. And if you're one of the millions waking up with ground down teeth, yeah, that too. Here's what nobody tells you. All of those things share the same root cause. It's not stress. It's not your posture. It's not that you forgot to stretch. The answer goes much deeper than that, all the way down to the cellular level. And once you understand what's actually happening inside your muscles, everything starts to make sense. The calcium myth. We've all been sold. Let's start with something most people get completely wrong. When you hear the word calcium, your brain probably goes straight to bones and milk commercials. That's what we've been taught since childhood. But here's the truth that most people never hear. Bones only use about 1% of the calcium in your body. The other 99%, that's running your entire biological system. Calcium is the language your body uses to communicate at the cellular level. Every muscle contraction, including your heartbeat, is triggered by calcium. Your eyes scanning across this text right now. Calcium. Your diaphragm expanding and contracting so you can breathe. Calcium. The tight, stubborn knot sitting right between your shoulder blades. Also calcium. But in that case, it's calcium that's gotten stuck. To understand why that matters, you need to understand how muscle contraction actually works, because it's one of the most elegant biological mechanisms in existence, and it explains everything. The on switch and the off switch. Think of calcium as having two jobs inside your muscles. When your nervous system sends a signal to contract a muscle, tiny gates open up along the muscle cell membrane. Calcium rushes in from outside the cell, where it exists in a highly concentrated state. Because of that concentration difference, a lot of calcium outside, very little inside, it flows inward almost effortlessly, like water pouring through a dam. That flood of incoming calcium is the on switch. It triggers the muscle fibers to grab onto each other and pull, generating force and movement. Now, here's where it gets interesting. To relax that muscle, to turn the switch back off, the calcium has to be pushed back out. And that's not a passive process. That's an active, energy-demanding job. The muscle has to essentially pump calcium uphill against that same concentration gradient that made it so easy to flow in. And the energy currency the body uses for that work is ATP. But ATP alone can't do it. For ATP to function, it requires a cofactor, a partner molecule that activates it and makes it usable. And that molecule is magnesium. No magnesium, no functioning ATP. No functioning ATP. No calcium removal. No calcium removal? The muscle stays contracted. It doesn't relax. It can't. It's stuck in the on position with no way to flip the switch off. Rigor mortis, palpitations, and the proof that it's real. If you want the most dramatic illustration of what happens when calcium gets stuck in muscles without ATP to remove it, look no further than rigor mortis. When someone dies, ATP production stops immediately. With no ATP, there's nothing to pump calcium out of the muscle cells. The calcium stays locked in, and the muscles, unable to release, go rigid. That's the eerie stiffness of a body after death. It's not some mysterious chemical transformation. It's just stuck calcium with no energy system left to clear it. Now, you're very much alive, so your situation isn't nearly that extreme, but the principle is exactly the same. When your magnesium levels are low, your ATP doesn't work as efficiently, and calcium gets partially stuck in your muscle tissue. Not completely, you're not going rigid, but enough to keep you in a state of chronic, low-level contraction that never fully releases. That's the twitch under your eye. That's the tension headache that lives behind your skull. That's the jaw that never quite unclenches. That's the heart that occasionally skips a beat or flutters in your chest when you're just sitting there doing nothing. All stuck calcium. All connected to the same underlying deficiency. The medication clue. Nobody talks about. Here's something worth thinking about. One of the most commonly prescribed classes of medication in the world is called calcium channel blockers. These drugs are used for high blood pressure, certain heart arrhythmias, and other cardiovascular conditions. What they do is physically interfere with calcium's ability to enter cells, essentially doing the job that magnesium is supposed to do naturally. Think about that for a second. If the solution is to block calcium channels, why not simply restore the mineral that does exactly that? Magnesium naturally regulates calcium entry and exit through those same channels. It's not patentable. It can't be sold for a premium. So it doesn't get prescribed or promoted. But the biology is the same. There's even a medication developed for Alzheimer's disease that works through a mechanism so similar to magnesium that researchers openly describe it as a synthetic analog. The drug essentially mimics what magnesium does in brain cells, and yet magnesium itself rarely enters the conversation in clinical settings. This isn't a conspiracy. It's just the economics of medicine. But it means that millions of people are taking medications to manage conditions that might respond, at least partially, to a simple mineral they're not getting enough of. The trap muscles, a case study in stuck calcium. Let's get specific and talk about the trapezius, the muscle responsible for more chronic tension than almost any other in the body. Most people picture the traps as that thick ridge of muscle that runs between your neck and your shoulders. But the trapezius is actually enormous. It extends from the base of your skull, runs all the way down your spine to the level of your 12th thoracic vertebra, fans out to the tips of your shoulders, and even wraps around to the front of your collarbone. It's a massive multi-directional muscle with a lot of surface area to accumulate tension. Here's the structural problem. The lower portion of the trapezius, which is supposed to anchor and stabilize your shoulder blades, tends to be chronically weak and underused in most modern people. We sit for hours at a time. We round forward. The lower traps get no activation and slowly become atrophied from disuse. So the upper traps have to compensate. They take on the work that the lower traps aren't doing, and they run hot. They stay in a low-level state of contraction almost continuously, trying to hold everything together. And here's the physics that makes it worse. For every inch your head drifts forward of your center of gravity, you add approximately 10 pounds of effective load onto your cervical spine and upper traps. 1 inch forward, 10 pounds of extra strain. 2 inches, 20 pounds. Most people walking around with their head jutting toward a screen are carrying an extra 20 or 30 pounds of load on muscles that were already overworked and magnesium depleted. The traps are also directly wired into your fight-or-flight response. When the sympathetic nervous system activates, whether from real danger or just chronic stress, the traps elevate and tighten as part of the defensive posture. Shoulders up, neck shortened, bracing for impact. For people living in a state of low-grade chronic stress, this becomes a resting position they never fully come out of. And magnesium is one of the key minerals that helps regulate and calm the nervous system's stress response. Without it, the brakes don't fully engage. The circadian pattern of magnesium, and why morning is the danger zone. Here's something that not many people know. Magnesium follows a daily rhythm in the body. Over the course of a 24-hour cycle, magnesium levels naturally drop to their lowest point in the hours just before you wake up. Think about what that means for a moment. That's why leg cramps so often jolt people awake at 3 or 4 in the morning. That's why jaw grinding tends to intensify during the later hours of sleep. And it's not just muscular problems. The risk of heart attack and stroke also peaks in the early morning hours, a pattern that has been studied and documented for decades. The connection to magnesium's circadian dip is not coincidental. When calcium ends up in the wrong places, there's another dimension to the stuck calcium problem that goes beyond muscle tension. When the body has chronically insufficient magnesium, calcium starts migrating into places it shouldn't be. It deposits into soft tissue, the joints, where it contributes to arthritic changes and stiffness, the arterial walls, where it accumulates as calcified plaque and contributes to cardiovascular disease, and the kidneys, where it combines with oxalates to form kidney stones. This isn't random. The body is trying to buffer and store calcium somewhere, and without the proper biochemical machinery, powered by magnesium, to keep it moving correctly, it settles where it shouldn't. You've probably heard that vitamin K2 plays a role in keeping calcium out of soft tissue and directing it toward bones and teeth where it belongs. What's less commonly known is that magnesium is the primary cofactor that activates K2. Without sufficient magnesium, K2 can't do its job properly. Once again, magnesium sits at the center of the mechanism. pH, alkalinity, and the hidden trigger for twitching. There's one more piece of this puzzle that often gets overlooked. Even if your magnesium levels are adequate, calcium can still behave erratically if your body's pH is off. Specifically, when the body becomes excessively alkaline, calcium begins interfering with normal nerve signaling. The nervous system becomes hypersensitive. This shows up as muscle twitching, random spasms, cramps that don't resolve even with magnesium supplementation, and an almost electric, jittery feeling in the muscles. What drives excessive alkalinity? Often it's a diet loaded with refined carbohydrates, sugars and starches that shift the metabolic environment in ways that throw off the acid-base balance. The most effective long-term solution is simply cleaning up the diet. When you remove the refined carbohydrates and return to whole, nutrient-dense foods, the body self-corrects its pH over time. For more immediate relief, a small amount of apple cider vinegar diluted in water, drink it through a straw to protect your enamel, can help restore a slightly more acidic environment. Betaine hydrochloride, a supplement that supports stomach acid production, can also be helpful, particularly for people who experience chronic indigestion or bloating. Acidifying the stomach environment has downstream effects on systemic pH that can reduce the calcium locking effect in the nervous system. The solution: practical magnesium protocol. So what do you actually do about this? First, stop taking calcium supplements if you're currently taking them. The vast majority of people in the modern world are not deficient in calcium. They have the opposite problem. There's too much calcium circulating in the wrong places. Adding more is like pouring fuel on a fire. What you need is magnesium. The most bioavailable and well-tolerated form is magnesium glycinate. The glycinate component is actually the amino acid glycine, which has its own calming, relaxing properties for the nervous system and is a nutrient that many people are separately deficient in. It's a genuinely useful combination. The standard recommended daily amount sits around 360 to 420 milligrams, but understand that this is the minimum floor to avoid deficiency, not a therapeutic dose. If you're dealing with active symptoms like muscle cramps, twitching, tension headaches, arrhythmias, or chronic trap tightness, you'll likely need significantly more. A practical approach for more serious deficiencies is to spread higher doses throughout the day rather than taking everything at once. Something like 250 to 300 milligrams taken 2 to 4 times daily, depending on your symptom severity and tolerance. Spreading it out improves absorption and reduces the chance of digestive discomfort. Be patient with the timeline. A persistent eye twitch might begin to resolve within a week. Chronic muscle cramps could take several weeks of consistent supplementation. Heart arrhythmias and arterial calcification are longer-term corrections that may take months. The deeper and longer the deficiency has been, the longer the replenishment process takes. This isn't a quick fix. It's a restoration. For people struggling with insomnia or poor sleep quality, taking magnesium glycinate in the evening, roughly an hour before bed, can make a meaningful difference. Magnesium helps calm nervous system activity, lower cortisol, and support the transition into deeper sleep stages. Topical and transdermal options. Not all magnesium has to go through your digestive system. Epsom salt baths are a time-tested method of transdermal magnesium absorption. Research has shown that blood magnesium levels do rise measurably after soaking in an Epsom salt bath. The magnesium sulfate absorbs through the skin. A 20-minute bath 2 or 3 times per week can be a meaningful addition to an oral supplementation routine. Topical magnesium oil, magnesium chloride dissolved in water to a slightly viscous consistency, can be rubbed directly into problem areas. Applied to the upper traps, the calves, the lower back, or the bottoms of the feet before sleep, it delivers magnesium directly to the tissue where you need it most. Many people report noticeable reduction in muscle tightness and nighttime cramping within just a few applications. The bigger picture. Your body is an interconnected system. Every signal, hormonal, neurological, biochemical, affects every other signal. But within that complexity, there is almost always one foundational imbalance that sits upstream of the rest. The one domino that, when it falls, sets everything else off. For a huge portion of the population living with unexplained chronic tension, twitching, poor sleep, arrhythmias, headaches, and stiffness. Magnesium is that domino. Not because it's magic, because the biochemistry is clear. Calcium drives contraction. Magnesium drives release. Without that release mechanism functioning properly, your muscles, your heart, your nervous system, they all stay in a state of partial, unresolvable tension. The good news is that this is fixable. It takes consistency and time, but the mechanism is well understood and the tools are accessible. And if you want to take things a step further, combining magnesium repletion with proper myofascial stretching techniques creates a genuinely powerful synergy. The magnesium restores the chemistry of release. The stretching restores the mechanical pathway for it. Together, they work in ways that neither does alone. That combination, and how to apply it, is exactly what we cover next.